Hi, my name is Leah Sisk. I'm a nurse practitioner student and I'm going to be doing a respiratory, cardiac, and an abdomen exam today. Okay? All right, the first thing I'm going to do is I just want to look at your general respiratory effort. See if you're using any accessory muscles. Okay, just take some breaths for me. Look at the symmetry. Okay, and that looks great. Okay. The next thing I do, could you slide your knees around that way and just sort of face the wall? I'm going to check your chest expansion. Is it okay if I just fold your shirt up a little bit so I can feel? Okay.
Yeah.
Hold hand too.
Not
Sorry.
too bad. No.
Okay, take a nice deep breath. One more. All right, good job. You have nice, good chest expansion. All right, the next thing I'm going to do is I'm going to percuss. Try to get underneath your shirt. Could you cross your arms for me? There we go. Try to get in between the ribs. Okay, just gonna go onto your shirt. Let's see. Tuck this in here. And I'm going to listen to the sides as well. Okay. One more. All right. The next thing I'm going to do is I'm going to listen. So could, with your mouth open, when you feel my stethoscope touch your back, could you take just a deep breath for me, please? Yes. Good. Good job. Okay, now I'm going to listen to the sides. All right, great. Everything sounds good. All right, the next thing I'm going to do, I'm going to put my hands under your shirt. When you feel my hands touch your back, will you say toy boat for me, please?
Toy boat, toy boat, toy boat, toy boat.
Good job. All right. The next thing I'm going to do is I'm going to do the front of your chest. So I'm going to turn around and put your knees forward. Okay. Okay, the first thing I'm going to do is I'm going to percuss. Between the ribs. All right, I'm going to have to go up, okay? Can you hold it maybe there with your arms? Okay, there we go. Let me get between the ribs here. All right, let me go. I should be going across here. Let me try that again. All right. Should do one more. Down here. All right. Now I'm going to listen. Deep breath, please. Mouth open. All right, one more. Doing a great job. Okay, good job. And then finally, I'm going to sit here. Okay, that concludes the respiratory portion. Now I'm going to do a cardiac exam, okay? While you're sitting up, could I just have you lean a little, you know, that better, sorry. Could I just have you lean forward just a little bit? Find your angle of Louis, come over. I think that's about right. Take it, exhale fully, then hold it. Okay, evaluating your aortic valve, and it sounds great. Okay, now I need you to lay flat. Well, I'm going to put you at 30 degrees, okay? There you go. You guys want to go? All right, the first thing I'm going to do is I'm going to palpate. No, the first thing I'm going to do is I'm going to look at your carotids. I don't hear any breweries. And I'm going to feel. I don't feel any thrills. Let's draw close. Okay, I'm going to come over to the other side. So I'm more comfortable there. Alright, the next thing I'm going to do is I'm going to feel your cardiac landmarks. I'm going to feel your aortic valve in. I can't fit. I'm going to go on your shirt. I'm going to put my hand here. Sorry about this. Close and personal. See if I can feel. Okay, good job. The next thing I'm going to do is I'm going to listen. Can I fold your box up a little? Just make it a little easier. Okay. Now I'm going to listen to your heart. Alright, I'm going to turn it to the bell. Listen to your uric acid. Okay, could I have you just turn slightly to your right? Okay, good job. Okay, that concludes the cardiac portion. The next thing to do about the abdomen. Okay, I'm going to have you put your legs out, bend your knees a little, put your head down a little so I can get to your stomach. All right, yeah, come in this way. Is this okay? Tell me if you feel comfortable. Okay, do you mind unbuttoning these and just rolling them down? First thing I'm going to do is listen. Listen for bell sounds. Well, first thing I'm going to do is inspect. And I don't see any petechia, no pulsating masses or anything. Skin looks great. And while I'm at it, I'm going to look at her precordium just under inspection because I missed that before. I didn't notice anything when I was examining her. There's no lifts or I think she looks good. Okay, so now I'm going to listen to your vowel sounds. Yeah, normal vowel sounds. Okay. The next thing I'm gonna do is I'm gonna feel the 4 quadrants. All right, tell me if you feel any pain, okay? Okay. And the next thing I'm gonna do is I'm gonna look for the margins of your liver. Okay, it seems like it's here. Okay. So what I'm gonna do is I'm gonna put my fingers under your ribs, okay? I need you to take a deep breath in and out and then take another breath for me, okay? Ready? Okay, one more breath. Does that hurt? Okay, I didn't feel anything. All right, the next thing I'm gonna do is I'm gonna feel for your kidney. Kitty bay? I don't feel it. Okay, I'm gonna come on the other side and check your spleen. All right, first I'm gonna check for the location. Could you just take some slow breaths for me so I can get this one set? Okay. All right, I'm gonna do the same thing again, okay? Deep breath. Exhale. All right, one more breath. I didn't feel it, that's a good thing. Okay, I'm gonna feel this kidney. It's kind of tight. All right, take a deep breath. Okay, and the last thing I'm gonna feel for is the aorta and the epigastrium. All right, you ready? Deep breath. All right. All right. And one thing I noticed I forgot is I forgot to fill your costochondromortals, so I'm gonna feel those real quick. Start with the ribs. I think you're sure. Does this feel painful at all? All right, and the other side. All right. Thank you very much.